So today I'd like to talk to you about different techniques and management strategies. If maybe you've been in a recent car accident or anything that may have caused you to have some sort of whiplash injury. Whiplash can actually be a pretty troubling injury. It can cause a lot of pain and dysfunction, and that's why I'd like to kind of highlight some ways that you can treat it, especially if it takes some time to get into physical therapy or get some treatment so that you can manage it a little on your own before you get some formal treatment. So the first strategy, so after a whiplash type injury, a lot of people don't really like to move their necks. It's very tight and stiff and irritated. So some people even wear like a cervical collar of sorts, or just really limit their cervical range of motion, which isn't the best idea. We really want to encourage motion and movement after an injury like that. So maybe instead of wearing a collar, which I would wear one if you have a doctor that prescribes one, but otherwise I wouldn't wear one yourself if you don't have to. But one option to limit the mobility within a comfortable range but still get the range of motion would be to use like a thick towel. So you can find whatever works for you at home, maybe a bath towel of sorts. So this one's not super thick, but find what works for you. So I'm going to put her around her neck here and she can kind of hold it. You could even put it in your shirt if you'd like to kind of secure it during the day, but the idea is that the towel will give her the sense of a little support, but not really limit her mobility. So you can see I'll have Adrienne here kind of turn her neck so she can feel it on the side of her neck and side of her face a little bit, and maybe tells her maybe it's a good place to stop for now. And so it just gives her that extra feedback, like this is a comfortable range, I'll keep my head from moving too far. And then she can progress as her mobility gets better to a smaller and smaller towel to the point where she doesn't need it anymore and can just move her head freely and more comfortably. So that's one technique you can use. I'll steal that from her. So with a whiplash type injury as well, a lot of times what happens with that quick movement of the head forward or backward, a lot of the small muscles and ligaments in the neck can get stretched and loose and irritated, and that can cause some problems in the neck. So what we like to do with therapy is retrain and strengthen those teeny tiny muscles in the neck in order to recreate that stability and calm down those irritated structures. So one way that I like to teach patients to do this in the clinic is pretend you have like a pencil at the very tip of your nose and make the tiniest little ABCs that you can with your nose. So I'll have Adrienne here do it. So if you can kind of see, she's doing just the tiniest head motions. And luckily, since these are such small motions, they should be pretty comfortable for the head and neck. So you're not moving through a large range of motion, but you're still kind of retraining those tiny muscles in your neck, which are really important for stability. So good, you can relax. Another exercise along the same lines that again is super simple, super easy, that you can do at home to retrain those muscles. So what I'll have Adrienne do here is she's going to keep her nose and her head pointed straight forward. And sometimes I like to have patients do this maybe sitting in a comfy chair, like lying in a recliner, whatever you might have at home. And her head's going to stay right where it is, so it's not going to move at all. And I'm just going to have her look as far up and down as she can with her eyes. So this seems a little strange because you're like, why do my eyes need a workout? But the idea here is that when we move our eyes, our head naturally wants to move with our eyes because our head wants to look where we're looking. So when we restrict our head from moving with our eyes, we turn on those little muscles to stop our head from moving. So that's going to strengthen those small stabilizing muscles again. Same thing, now let's go side to side. So again, similar idea with those muscles restricting our head from moving when we hold our head in place. Good. All right, you can relax. So those are just a few simple exercises that you can try if you, like I said, have experienced maybe a car accident or any sort of incident that caused you to have some whiplash type symptoms. But in general, we really encourage that you go see either your doctor or a physical therapist right away if you think you have a whiplash type injury, because research has found that the first 3 months after an injury like that are critical and can really be important for your long-term success after that type of injury. So best to get in right away, get some treatment, and get it figured out sooner rather than later.